So I'll recommend people use different types of light therapy, but the most, I guess, easy and accessible one and free is the sunlight. So there are these things that I like to encourage people to investigate or use, like binaural beats is one of them, where you listen to music that has different frequencies that start to reshape your brain's sense of where it's at through different brainwave functions. And some simple solutions, as we talked about during this podcast, and I'll try to lay it out in a simple way, is I think it's really important to get our circadian rhythm optimized.
Welcome to Beyond the Pain, the podcast that explores what it really takes to break free from chronic pain and reclaim your life. I'm your host, Leigh Brandon, and someone who's spent over 2 decades helping people get to the root cause of pain that no one else could explain. Whether you're dealing with long-term back issues, joint pain, nerve discomfort, or mysterious symptoms that just won't go away, this show is here to help you go deeper. Because beyond the pain, there's clarity, strength, and power waiting for you. Each week, we'll uncover the physical, emotional, biochemical, and energetic causes of pain and how to transform them. Let's dive deep into this week's episode. In this week's episode, I'm joined by Michael Blahut for a fascinating conversation about how light, sound, movement, and energy medicine may all play a role in supporting healing and improving the experience of chronic pain. A lot of people think of pain purely in physical terms, but as you'll hear in this discussion, there may be much more to the picture. Michael shares his insights into how aligning circadian rhythms, using sunlight and light therapy, exploring sound and frequency, improving movement and posture, and becoming more aware of the body's energetic systems may all help create a healthier internal environment for recovery. We also touch on the effects of stress, toxins, EMFs, emotional states, and daily habits, and why a more holistic approach may open up new possibilities for people who have been struggling for far too long. So if you're interested in a broader and more natural perspective on chronic pain relief, this is an episode you won't want to miss. Michael, welcome to Beyond the Pain. It's great to have you on the show.
Yeah, thanks for having me, Lee. It's an honor, and it's going to be exciting, all the topics we have to talk about today.
Absolutely. So I always like to start at the beginning. So before we dive into the tools and techniques that you teach, could you share your story, particularly, what led you into the work that you do, and how did you come to understand pain in such a unique way?
Yeah, I mean, for me, it's been a more experiential story from my own life because my own personal, I guess, education has come through just exploring what's relevant to me. And how I got to where I am today as an osteopathic physician, family physician, is through environmental science. And so there's been many steps. So I was in a volunteer organization we have in the States called the Peace Corps, and I was set out in the Fiji Islands in the South Pacific. And what I realized is that working with people there in their environment was that people were getting really sick and not treating their health right, and that affects the environment. So my backwards thinking was that, well, we have all these people, they're not healthy, creating these unhealthy environments, and how do we teach or rearrange? So then I realized I love working with people. But something else really significant happened to me when I moved from Fiji back to the States. I thought, all right, I need to figure out what I'm doing. So I moved to LA, and I was in Venice Beach and learning about yoga. I got training in shiatsu and hands-on work and all kind of alternative, what they call alternative health modalities. And I met my, now wife at a yoga training, and she was doing, she's from Italy, and she had a lot of health issues related to autoimmune thyroid diseases that I ended up realizing through her experience that doing alternative things actually helped her to heal herself. So during this time, we met, and then I offered for her to stay with me because she was doing a lot of alternative treatments in California and finding ways to help herself. And my eyes were just totally opened up to the world of figuring out a different approach other than medications and surgery for treating things because she really didn't want to have her thyroid removed. She wanted to figure out what else could be done. And I was very curious at that time. So we learned a lot. And through her experience, it inspired me to go into medicine and osteopathic medical school because I was really surprised at how someone in one condition can say, this is a condition that we have to cut your thyroid out. And if you do that, if you don't do that, you're going to die. She's like, I don't think so. Let me find a different way. And she did. And she's totally fine and healed today. So I'm use her as my springboard to inspire me. I'm like, wow, this is fascinating that our bodies work in a different way than what I was taught, even going through regular, college and so forth. And then I really pushed into different alternative methods. And then I thought, all right, I got to go to medical school and figure out how to help people in this way.
Cool. So how long ago was it you went through osteopathic school?
That was about almost 10 years ago.
Okay.
So before that, I was actually doing environmental science. And then, like I said, I worked as a hands-on therapist. I worked in sports. I worked with Asian medicine or Chinese medicine, acupuncture. I studied with a Japanese shiatsu teacher for a couple years, and he trained me to be a teacher. And then I realized, like, if in order for me to do Japanese like type of shiatsu, like basically I got to speak Japanese and learn everything. I thought there's got to be a different system. And I was introduced to osteopathic medicine from a doctor I was working with, and I never heard of it before. So then I had some experiences. I kind of shadowed and worked with some DOs in the States, and I really was inspired because they're speaking my language, but more in Western terms.
Mm,
And I didn't know that type of medicine existed.
mm. And have you done any more study since then? I'm guessing you probably
Yeah, I
have.
mean, from that, I kind of go off into like medical acupuncture. Then I tried, well, what my forte is now, what I really love is craniosacral therapy, and that really gets deeper into people's nervous system. And it's kind of a uniquely osteopathic approach that has spread all over to any hands-on therapist because it's so powerful and yet simple, but very deep. And I keep every year I do hands-on training deeper and deeper into the realms. It's more focused on biodynamic osteopathy, biodynamic craniosacral through the lineage of James Jellis, who was an osteopath in the States that learned from founders basically of osteopathic medicine. And to me, it's like a mind, body, spirit approach. And that's what really drives me is to look at the whole person, to really feel like we can get to the root cause of things and to heal on many levels. That's super
Mm,
important.
mm.
Yeah.
Yeah, interesting. I'm sure you're probably like myself. I just have this burning desire to learn, and
Yeah.
I just can't stop learning. It's just something I love to do,
Yeah.
and the more you learn, the more people you realize you can help, which I suppose at the
Well,
end of the day is the most important thing.
100%. Yeah, and if you're stuck like in a rigid mindset, well, I learned what it is and I'm expert at this technique. I think that is a little bit, it slows you down. And this is another thing. The more you learn, the more you realize you don't know. And so you keep wanting to learn more. And that's a great sign of a good therapist, of a good doctor, of a good practitioner, is that they're not necessarily saying, I know it all and I'm the best, because sometimes the ego helps, but most of the time we end up missing out. And what I find when I help people, it's more about me listening than it is me talking. It's more about me understanding who's the person in front of me and asking good questions, just like what you're doing. I think it's very important more to be in this mode. And how to help people is really to get to know that person really deeply, right?
Mm. Yeah, there's an old saying, isn't there? We've got two ears and one mouth, and that's for a reason, right? You
Yeah,
should
two
listen.
ears,
You
two
should listen
eyes.
twice. You should listen twice as much as you speak, right?
Yeah, I like that one.
And and
Yeah.
it's interesting. And I'm sure I've mentioned this before on the podcast, but sometimes I'll be doing a session with a client, and it's a 30-minute session. We're 20 minutes in, and I still haven't said anything yet. And you mentioned the word ego. Sometimes my ego thinks, yeah, but you should be doing something, right?
Mhm.
I
Yeah.
mean, I mean, I always feel like, quite rightly, I should be adding value, right? If someone's spending their time and they're investing in me
Right.
to help them,
Yep.
I need to be giving them value. But sometimes I have to stop myself and say, but you are giving value because you're listening.
Mhm.
I think listening's a really underestimated. I know, is it a skill? I guess it is a skill. right?
Definitely a skill because you can pretend like you're listening, but you have a million thoughts in your head about what you're gonna say. Or the other thing is, and we have this statistic in the United States, I don't know about in the UK, but, I worked in family medicine, family practice for a while, and they say that it's somewhere between, I don't know, 2 to 3 minutes that a doctor will let a patient speak before they interrupt them, and that's, like, the maximum amount of time that, your ability to listen for, and I think that's really quite sad. We need to
Mm,
be able to listen before we decide to do anything, and that's part of the healing, like you're saying, and it's so important. It's just for someone to express themselves, what they're thinking, what they're feeling, what they feel like the story is behind their symptom. And I mean, I pretty much will just let someone solve their own problems. That's really, it's like, tell me, oh, and when did
mm.
this, and when did this, and how about this, did you try this? And then they say, "Oh, you know what? I just realized this thing." I had a patient the other day, and this is good about telling a story, that I was working on them. They had a lot of head issues. They had some pain in their eyes and their sinuses. I said, "Did you ever have any head injuries?" "Well, I was in this whiplash car accident, but my head didn't hit anything." I said, "Okay, sounds interesting. Let's take a look." So I do a treatment, and then afterwards, she's like, "I remember when I was a kid, my father got really drunk and he punched me in the eye, and I didn't remember that until now." I was like, "Wow, okay.
Wow.
How does that feel?" Well, that's interesting. So sit with that. And sometimes those things are, I know that your podcast focus on pain and healing. It's really important to recognize the depth at our biology, our psychology of where it hides, and in memories is a very important one. And I
Mm,
don't say we need to psychoanalyze. Well, how do you really feel about that? But what I say, you just got to feel it. You got to remember it, and then you bring it back into your system, your health, and then you just like, well, that's an interesting memory. Maybe don't attach any emotion or attach any story to it. Just like, ah. And I find that's happened several times where people have a memory, then the pain goes away or their complaint gets better and doesn't, maybe not 100%, but it starts moving in that direction. Has that happened to you before?
well, it's funny you say that because, a friend of mine that's been on the show a couple of times, Liz Wong, she did the training with Peter Levine. I'm not sure if you're familiar with
Hmm.
Peter Levine's work.
Yeah,
So
definitely.
so he
The body
suggests that
keeps the score. Is that
uh,
some
I
of his
think
work?
that's Basil van
That's
der Kolk,
okay. Oh,
I
Basil van
think.
der Kolk. Yes.
Um, but Peter Levine says that trauma likes completion,
Oh, yeah.
and it sounds like what you were just describing was the completion of the trauma. It had to come out, rather,
Mm,
if it's being buried, it's not being completed.
right. Hmm.
Um, but yeah, I mean, from my own experience, because I do energy work
Hmm.
as well as physical, um, there have been times when you release an emotion from someone's body that's been trapped there for, however long. And at the end of the treatment or the next day, they say, yeah, my pain's completely gone,
Right. Yeah.
which is it's slightly different to what you were saying because it's done more on the subconscious level, but it's a similar
No, it's
concept.
true. And I think whatever we describe as, you're describing as energy work, I think we're doing that all the time. And
Mm,
if you start to get good at what you do, you start to realize, in osteopathic medicine, we have different bodies that we work on. We can call it a different body that you're working on. And whether it's an emotional body, it's a memory body, even our sort of I guess prenatal genetics and our memories inside the womb. And that's like a real thing. It's not, I know some people get like, I want like real science, and to be honest, this is most of the real science we're getting these days, is understanding who we are and how we are as a whole body genetic memory. And if we don't ask the questions about, what is genetics, what is our body, how do we even form as a fetus, which I think is an incredible, like the study of embryology is
mm,
really amazing, because what we're figuring out is that we have these cells that just decide to build a human, but how does that work? And we still are in this, mystery about the, potential information that comes in and tells us as a being to form. And so to keep that open is that, whether we call that energy, information, I mean, obviously we have, right now we're talking through these electric signals and we make reality work. We have our cell phones. Information's being passed through the air all the time. We don't see it, but
Mm,
we make use of it through our technology. And to think that our bodies or nature doesn't do that, I think we're missing a lot. And
mm,
to be honest, all of our technology just mimics, the physics, the quantum physics and biology that's happening all the time. We're just learning how to tap into it. And I think it's really important, just, like you said, if we're not getting good results in one way, to keep our minds open and to uh, work in a different field, in a different way. And some people don't like the word use of energy, or the same for like Chinese medicine uses qi, Japanese called ki and prana. And so all these you know, other health systems, they totally recognize it, and that's something we've
mm,
missed in the West, I think, and it's
mm,
crucial to recognizing that we're not just a bunch of cells glued together somehow. It's that there's a lot more going on here, and to be curious about it.
mm. Yeah, I mean, if you want to go down the science route,
Yeah.
you go down to the atomic level, right?
Uh,
What's an atom made of?
right. Mostly space.
Mostly, well, energy, vibration, right?
True. Exactly.
And, an analogy to use, if someone doesn't believe in, you can call it energy medicine, vibrational medicine, whatever you want to call it. If they don't believe in that because they can't see it, and say to them, how does your computer work?
Yeah.
How do you access the internet? Well, Wi-Fi. Okay, can you see the Wi-Fi signals coming into your
Right.
laptop? Right.
Exactly.
So, and science will tell you what is that? It's a vibration. Wi-Fi is a
Mhm.
vibration. It can tell you exactly how quickly that vibration is resonating. Right.
Mhm.
Whether it's
Yep.
4.2 hertz or 4.3 hertz or whatever it is. Um, so I think science is catching up. I've said many times on this show, people use the word woo woo, and I always stop them and say, I believe that woo woo is generally things that science doesn't yet have the technology to measure.
Exactly. Yeah, I totally believe that, because even if you think about the trend of where we've been in the past and what we've discovered now, that it's always changing. Our knowledge is changing, our science is changing. To rely on something we learned 50 years ago is keeping us, slowing us down. And that reminds me of a quote I say to people all the time, because I do what we call functional medicine, alternative medicine, and people come like, why should I talk to you instead of my regular doctor? And I said, because the first day of medical school, I was there, and I remember the instructor saying, half of what you learn here will be outdated by the time you graduate. And that's the problem, is that most people
Mm,
have a hard time to change their ideas, change their thoughts, to change the education platform that they've built up, because it means that maybe we were wrong about something. But admitting that we were wrong is way better than keeping a false narrative and in perpetuating, either ill health or symptoms that could be healed otherwise. So to keep that idea in mind is just like you said, like there's a lot happening here that we don't know. So be curious. And when it
mm,
comes to health and healing, 100%, we don't know why so many things happen in our body. Our body is way more intelligent, and life is more intelligent, nature is more intelligent than I could even wrap my head around. So it's really been my goal to just align people back to what nature is doing, and let nature do what it does best. Let our body do what it does best, and try to give ourselves a bigger picture of what health could be. And I
mm,
do find, that sounds like, all right, that's a nice philosophy. Like, how do you do that? Well, that's where I like to be really practical and come up with, some easy solutions, and some, just give people some tasks, give people prescriptions that are not medications, but do this every day and see what changes.
mm. Yeah, just going back to what you said about, why should someone see you rather than someone who's practicing medicine? The first thing I would say to that is we need to, people need to understand who controls the curriculum in medical school, right? And it's
Yes,
the pharmaceutical industry. And
correct.
what's their legal obligation to maximize profit? How do they do that? By people that are sick. So,
Hmm.
what's the difference between medical doctor and someone that practices functional medicine? Well, look at their curriculum. So as a medical doctor, you're going to learn anatomy, physiology, pathophysiology, symptomology, pharmacology, right? So they're very good at pattern recognition. They can spot a symptom, and then the algorithm will tell them what medication or surgery they need to give that person, right?
Correct. Yeah.
As a functional medicine practitioner, you're trained to find the root cause of the problem and to help that person live their life in a way that reverses the thing that's caused the problem, right? So that would be my
Correct.
view
Yeah.
on why someone should go and see you rather than seeing someone that's practicing medicine. Um,
Yeah.
um,
I mean,
and and
it's
each
totally
person can
true.
make their own choice, right?
Right.
So, like if I'm working with someone, even before I agree to work with them, one of the questions I ask them is, "Do you want a long-term solution or do you want a quick fix?" There's only
Yeah.
one
It's
correct
good to
answer if you want to work with me.
yeah. Well, even just to ask that, of course, people are going to say, I find they're like, no, no, I want a long-term solution. Say, really sit with that. And, are you asking me to prescribe you a pill or just fix things right now? Or are you willing to go through what it takes to change and at a deeper level, meaning that you will become a new person when you get out of this? And that's not always easy. It's not
Mm,
fun sometimes, but when you recognize that there is light at the end of the tunnel and it requires work, that means like what I always say too is you get what you pay for. And that means that if something's free or someone's offering you a quick fix or even in the United States, I know you have a different system in UK. We have insurance, and you don't have to. People are always like, well, I don't know because my insurance doesn't cover this or that, or my insurance won't cover me to see you. I said, you get what you pay for, and that means that the effort and the energy you put in, and if you find value, it doesn't always have to be a monetary thing, but it means that when money is our own energy and time kind of objectified and we have this
mm,
dollar or we have gold or silver, and when we look at it, where do I use my money, which is equal to my energy and time wisely, then we start to make different choices from the food we eat. Well, something costs more. Well, it's better for you. You're going to actually save money now because in the future, if you're sick or you have chronic disease and you're on 20 medications or you can't get out of your bed, you're going to pay for it at that time instead of paying for it now. So
mm,
and that's also the case. We have, like I mentioned, I study environmental science, and it's the same. When we have these sort of passing the dollar or passing the buck down the line, we end up creating a situation where we spend more money to fix a problem that would have been cheaper if we would invest it at the beginning. And that just means changing habits or changing our thinking about things.
mm,
Same for healthcare. And if pills are helpful to as a acute solution usually, and that means like we can have compassion. That's why I say, all right, let's do something now that at least you can get out of bed and move or do something, but you need to do something else or else we get trapped in this loop relying on the medications. It might even work for a few weeks or a few months, but it's not going to work for the rest of your life to rely on a solution like that. It's not
mm.
typically how our bodies work.
Every week, I meet people who've been told their pain is just aging, just wear and tear, or something they just have to live with. And almost always, there's a deeper cause that's being missed. Gut stress, emotional load, sleep disruption, food sensitivities, poor breathing patterns, movement imbalances. And when we look at everything together, the picture becomes clear. If you feel something important has been overlooked, book a discovery call with me at bodycheck.co.uk/consultation. That's bodycheck.co.uk/consultation. All right, back to the episode. Mm,
And in regards to the pharmaceutical thing, when I went to school, I studied at a more, I guess, historic osteopathic medical school in the States. And I had a lot of older doctors that I was around, and they were in the 70s and 80s. And their perspective was really helpful because let's imagine even 50 years ago, they didn't have half or even a quarter of the medications that we have today. So they said if someone was on more than one medication, they knew they were not doing their job correctly. And
mm,
unfortunately, today, there's an average when people reach 65, I think the average medications is 5 or 6 different medications. And it's not to say that it's a bad thing if you use medications. I just feel like we're not getting to the root cause, or we're not really helping somebody if we focus on that.
Mm. Yeah, one of the questions again I ask people before I agree to work with them is, have you ever considered what you might have to do less of or give up in order to be successful? And I find you
Hmm.
start to see the cogs turning in the brain when you
Yeah.
ask that
Yeah.
question, because it does require commitment, right, to go down that kind of path. And I don't want someone to
Definitely.
start with me if they're going to just throw the towel in the first time there's a spoke in the spoke in the wheel, so to speak. Um, one
Yeah.
one of the
Yeah.
one of the things that we both agree on is that pain isn't something to battle against, but it's a message from the body. How do you help people shift into that perspective, and how does it open them up for their healing?
Yeah, I mean, this is obviously our body is doing something, and pain, we can say is a signal. And it's just like, you're driving a car and you watch, a signal, a light comes on. Now, you think something, a light, check your engine. Okay. It doesn't always mean that the spark plug's wrong. When you see that light, it could mean 100 different things. But we need to start to diagnose or go down a pathway to investigate what's going on. So, how I ask people is just, when did the pain start? Tell me what was going on before. Tell me what's going on after. What things have done, what things have helped you, what things have not helped you. Then people start to realize, sometimes when you're in pain, I'm sure you realize this too, is that all you can feel and experience is the pain, and it's bad and doesn't feel good. Then we start getting stuck in this story, and it's a loop, a neurologic loop and a physical loop and a emotional mental loop. So what we have to do is start to interrupt that loop by understanding, wait, there's must be a message here. And what is this trying to teach me? Or let's go to a time when I didn't have pain. I can remember that. And then how do I figure out this? What is it that happened to me between that point where I didn't have pain and now I do? And that's the root cause analysis. That's part of a good diagnostic approach to pain, whether it's a physical pain. Okay, if I touch you here, does it hurt? Or it hurts all the time, no matter what you do. So really what it is, it's all about asking the right questions and then getting the person to experience different approaches to give them feedback. Oh, this helps or this doesn't help.
Mm,
And I feel like in medicine, when the common approach isn't helping somebody, we just top it up as, oh, you just have chronic pain, take these pills. To me, what your body's saying is something is happening, and we shouldn't have to give up just to take pills to cover up the signal, but to ask different questions. And those are the people that see me. I'm sure the people that see you that haven't gotten solution to the common approach. It doesn't mean like, oh, well, I sprained my ankle and I need to wear a brace for a little bit and the pain goes away. We're talking about people that really live with a lot of pain, a lot of dysfunction in their daily life because of symptoms. And this usually takes a little bit of deeper investigation and questioning, figuring out what's helped, what hasn't helped, and to think of it as a body, mind, spirit approach, not just a biochemical pathway gone wrong.
mm, absolutely.
Good.
So I know you work with a lot of natural elements, and this is something I'm really interested in. So things like light, sound, and movement. How can these actually change the way that the brain and body interpret pain?
Well, I like to, kind of go back to what I call our original biology or original biological blueprint that we have set up as being a living organism on this planet. And what that means is really our body's set up to receive these signals from our environment, interpret them, and to create the most balanced, healthy situation possible. So when I think about as a practitioner, as a doctor, what are the tools that I have to help somebody in these situations? I get really frustrated if I just think, oh, I can prescribe another medication. What else? Because that doesn't seem to help somebody. So that's what drove me to look at these other elements, especially what nature's doing all the time, and to understand how our biology is basically built to work with these elements, and that includes light. As you mentioned, I talk a lot about changing our relationship to light, and also using technology in our favor is fine, but as long as we understand what we're doing. So light as a signal to our brain and our body is very important. And for many reasons, our biology, most living things have a relationship with light due to sunrise, sunset, circadian rhythms. And as for our mammals, mammalian biology is super connected to these circadian rhythms of when we're supposed to do things. It gives a signal to our nervous system if we're in a time of abundance or in a time of scarcity. And those times means we need to do different things. When I try to help somebody with pain, what's interesting is there is a lot of research about light, infrared light, heat, I'm sure you know, and all this is a way that we can use these signals to support our own healing, whether it's from better circulation, stem cell activation, increasing hormones that are building blocks for life, and improving our mitochondrial functioning, which is really at the root of our engine of ourselves. How do we get more power, electricity, electrons moving? And that will just promote our healing response. And sometimes we might say, let's say somebody who has had an injury, a fall and sprained their shoulder, and it's just really nagging and bothering them chronically. It's really hard when we have injuries on parts of our body that we use every day. And most people use their
Mm,
arm, their hands, their feet every day. So it's hard, like, just rest it. Well, I can't. A mother who's carrying a baby, arm's really painful, then they get tendonitis or inflammation in a joint, or some of these things are that we need to provide better inputs for our biology. So I'll recommend people use different types of light therapy, but the most, I guess, easy and accessible one and free is the sunlight. And I
mm,
feel like, medicine, and over time, we've miscalculated the importance of sun. We live indoors all the time. We shield ourselves with sunscreen. We block our eyes from the sun. Windows are blocking UV and infrared heat, which is really critical for our body's functioning. So changing the relationship to sunlight is really important for our healing response. And how to do that, I recommend people at least getting outside for a certain period every day, 20, 30 minutes, get under the sun, and then you can start timing that better. Like, get your circadian working properly through looking or getting out into sunlight in the early morning. That helps to build our melatonin stores, which we're learning is really critical for our sleep architecture, where we do repair and healing, and it's a huge anti-inflammatory molecule in our system.
mm,
So melatonin has been really thrown out of balance because of our artificial lighting indoors, our screen time, high spikes of blue light, which suppress melatonin release, and that's all coming from the artificial light. So I find it's really helpful to change our relationship to light and start to learn how to use what nature is doing in its normal biology. We can mimic that with some different type of light bulbs, or we can really be smart with turning the lights off early at night, putting blue light filters on our screens. I wear glasses that filter 100% blue light, especially if I'm looking at a screen or device at night.
mm,
And the question is, like, well, how's that really going to help me? Well, what we've seen is that people sleep better. And when you sleep better, your body is better at everything else. So that's
mm,
like the bare minimum, is that you're sleeping better. Your body's able to heal. You're able to feel more energy in the morning and do the things you need to. Plus, the brain senses these artificial lights as an abnormal stimulus. So our nervous system is getting stimulated in that sort of fight or flight or the go, go, go response too much. And then when we stimulate that too much, we get burnt out. Our body doesn't have the right cortisol rhythm. And obviously, that will affect people's sense of pain. So light is really important. And I think it's a forgotten part of medicine. We used to use a lot of time back in the day, people, when they were sick, even with pneumonia, we would put them in these solariums out in the sun, lay in fresh
mm.
air. And that was like one of the best treatments.
Yeah,
And
there
we
used to
do
be.
have evidence.
I
Yeah,
was
go
going to
ahead.
say hospitals used to have sun decks
Sunbeds. Yeah. In
or
hospitals,
sun
people just
decks
say,
they were called, where the beds were on a
Move
deck
the bed
outside.
outside and
Yeah.
get sunlight. 100%, and we forgot that, and actually now during COVID, I saw there was a few studies in Brazil that people were moved outside and they were discharged faster. So the more and they did it as to a way to control, viral or some infection, but actually what happened was that people were healing faster when they got natural sunlight, and wow, what a concept, it's really part of our biology that we forgot, and almost in medicine, like we think, oh, you're sick, I'm going to give you these pills. Like, how much important is it just to go outside, get fresh air, and get sunlight? And it seems trivial, but it has a huge impact on our health.
Yeah. I mean, living in the UK, it's a bit of an issue because we don't really see the sun because they're spraying the skies so much now.
Yes,
Um,
I
I mean,
know.
it's been
Well,
it's been
same in
it's
the
been
States and a lot of countries. Yeah.
yeah. I mean, this week it's barely not rained. It's been raining pretty much all the time.
Mm.
Um, but it does remind me I will be on my or in my infrared sauna with my red light this evening before I go to bed with my blue block
Yep,
glasses on.
exactly.
You
So
gotta try and get
you're
as much
doing
of
it
it as
too.
you can.
You got to. And I think that
Yeah.
we have technology and we have science to say that this is good for us. And sometimes our environment isn't supportive in this aspect. So then we got to use what we can to take advantage of those things. And even if it's changing your light bulbs to incandescent lights, I know these are being banned in certain areas because of the electricity consumption, but it's really a shame because the LED lights and fluorescent lights are very harmful for our body, and there's so much more evidence coming out that the type of lighting we have in our homes is critical. And even if you get a incandescent red light bulb and you just shine it by your bed at night, you're going to get some of those benefits instead of reading or watching something that has a high amounts of artificial light. And as you mentioned, for some reason in our world we live in today, it's actually becoming more of a public topic about this geoengineering and the sky spraying because they're supposed to be stopping global warming or whatever kind of nonsense information's out there. I think there's enough evidence to say that it's bad for our health and people really need to push back about what's going on. Or like in your cases, we figure out how to utilize the technology we have in our favor. And for me, I moved to Costa Rica not because of that issue specifically, but because I know I feel better in a different environment. And we probably all need to question that at some point
Mm,
when it comes to we're in a place where we have chronic pain and we're doing all the right things, and someone says I got to eat this way, someone says I got to take these supplements and I got to do these exercises, but start to look at what's your surrounding environment. And our world is changing very rapidly, where there's so many signal inputs that our body is telling us that our environment isn't healthy. And it doesn't mean you have to leave, but you have to be smart about how we're living, and changing the light bulbs, turning off Wi-Fi's and watching out for EMFs is important. And then even
mm,
looking in our homes, because I deal with a lot of people who have mold issues in our homes, and our toxins that are around us is super important to investigate. What is that's
mm,
triggering? Because our brain is giving us a signal something's wrong. And now let's open our mind to what that could be. And there's ways of testing and there's ways of figuring this out.
mm. I also seen studies that show that non-native EMFs actually make mycotoxins even more potent as well. So there's a double
Right.
whammy.
So there's two things that happen, and that one is that it will kind of create inflammation in our brain and increase the amount of toxins that cross through the blood brain barrier. So there's some studies that show these non-native EMFs create inflammation in our body, our brain, and more toxins will get in. Mold will grow better in an environment that is something like EMF is damaging to some biological organisms. So things don't grow as well. So mold will take the advantage and grow more in homes and other situations in a high non-native EMF or like a more toxic EMF environment. The other thing that I've seen there's some data on is that it's not always just the mold, it's the mold breaking down the chemicals in our
Mm,
homes that
yeah.
we breathe in. So we have toxic paint, particle board, all the carpets, all the artificial stuff in our home breaks down and becomes what they call VOCs, volatile organic compounds, and we're breathing them in. Our body has to detoxify. And at some point, we build up the toxins and then we tip over and our body starts giving us signals. And that can come from chronic pain, brain fog, and even anxiety. I've seen people have
Mm.
really high anxiety for no apparent reason. And then I start to look at what's your environment going on, or what are the toxins around you. And we start to check on is mold an issue or other environmental toxin.
Yeah. Yeah. So that's light. What about how you work with sound?
Yeah.
You are not broken. Pain isn't a punishment, it's communication. One of the clearest messages your body sends is through inflammation. When you nourish yourself in a way that supports your gut and immune system, pain naturally becomes easier to manage. The Pain Free Plate shows you 7 foods that help bring your body back towards balance. And you can download it for free at bodycheck.co.uk/pain free plate. Now, let's get back into the conversation.
Sound I find very interesting because it's another one that, let's say, we have these senses. This is another approach that I look at. If our senses are built to interpret the environment and they are information to our system. So if we're able to work in the way that our body's designed to pick up information, we can reprogram that information or at least provide it with positive information so that our bodies start to get the signal to do something different. Sound is affects our body through many ways. And we have sound, obviously, through our eardrums that our brain interprets as signals and then tells our body, are we in a safe environment or a threatening environment? So there are these things that I like to encourage people to investigate or use, like binaural beats is one of them, where you listen to music that has different frequencies that start to reshape your brain's sense of where it's at through different brainwave functions. And people that are in chronic pain tend to have like a high stimulatory state of their brain, and that means that you're on alert all the time and it doesn't feel good. So we can help to calm the brain down through listening to sounds, although it's a kind of a patch in a way if you don't know the reason why you're in pain or reason why your brain is stimulated. Sometimes it's just a memory that we try to reprogram from like a PTSD response. So listening to positive sounds or sounds that put your brain in the relaxation state or in better healing ways like gamma waves, that helps the body to start to signal the repair healing response to activate the parasympathetic nervous system. So I will recommend either listening to binaural beats, and you can search that and find stuff online that are good tested frequencies, and they have to be listened with headphones, one on each ear, because that affects the way your brain interprets the signal. And then there's these other things that in, let's say, Asia, they did a lot with the sound through singing bowls and
Mm.
changing our interpretation of the sound waves around us because that's a whole body experience. And I found that I've personally had experiences where really powerful healing from sound therapy sessions that my whole body starts to resonate or feel that it's all connected. And when we start to connect places that have been stuck, we start promoting a healing response. And that could just even be chronic neck tension or even areas where we had past injuries that start to be relieved when we're in this sound vibration response. So singing bowl therapy is another one. And the third one I really like to promote is just getting out in nature, because nature has sounds that in general,
Mm.
when things are going well in nature, it cues our nervous system that we're in a safe place. And nature, from bird calls to bees to just hearing the sound of leaves in the wind, are all signals to our brain that we're in a healthy and healing place, because we've been missing out on that so much, locking ourselves indoors, working on computers all day, that our nervous system can have a profound shift when we put ourselves in nature, just from the sounds and even the colors and the light that we see and the smells of the volatile organic compounds from nature. These are like essential oils that come out of pine trees or eucalyptus or other things, even those things. And that's why nature is a powerful healer if we let it do its job. And so that's how I recommend people using sound in general as a everyday therapy or medicine, is if you don't have time to go outside, you can listen even to nature sounds before you go to bed, and it will calm your nervous system.
Mm. Yeah. Before we started recording, I was saying to you, I moved out of London, but 6 years, just over, well, 6.5 years
Mhm.
ago now. And for years before I moved out of London, I was visualizing me living at least right on the edge of nature. And
Uh-huh.
I visited, when I first visited this place where I live now, I, w- I didn't know anyone here, but I just said, I have to live here. And I live on the edge of a canal. So the canal runs right by, I have a balcony that overlooks the canal. And
Oh,
each
nice.
day I walk to the gym, it's 10 minutes away, well, not even 10 minutes. And just before the gym, there's this huge, not in depth, but in length, like a waterfall. And, in the canal, there's swans, there's ducks, there's geese. You got
Oh,
the
yeah.
flow of the water.
Amazing.
And there's within about half a mile, there's 4 different rivers. And when I go walking, 'cause it's a lot of farmland around here as well. And when I go walking, every so often there's like a little waterfall. And so it's really, I try when it's not tennis season, I get out and walk a few miles every weekend. Um,
Amazing.
but I had an experience with sound. So back in 2013, I ruptured 2 discs in my lumbar spine, and
Mm.
it kind of came at the wrong time because I was meant to be in San Diego and I couldn't sit down. So obviously,
Oh, wow.
getting to the airport and then getting on a plane was a problem, but I managed it. But I was not in a good way. And whilst I was there, um, we were having a big meeting, and we all did Native American drumming. So there was about 14 of us in total, I
Oh,
think.
yeah. Yeah. Mhm.
And I was drumming away, and kind of my mind was, in a different planet. And then I realized I haven't got any pain in my back. And it subsided for quite a while. Like, it did come back, but whilst I was drumming, and for some time afterwards, the pain was kind of completely gone. And
Yeah,
it just
amazing.
makes you realize. And again, what is music? It's vibration, right?
Right.
That's what life is.
It's incre
And I had another
Yeah.
experience with a client. She actually had eczema, and I remember she said to me, she went to a sound bath, and it was probably eczema as bad as you've ever seen it, right? And she
Mm.
went to this sound bath, and her skin was clear,
Wow.
which is
Yeah.
incredible. And I
Yeah.
actually,
That's amazing.
when I go to bed at night, I actually listen to, I'm trying to remember the name of it, uh, Sonic Meditations, but I'm trying to remember the name of the guy.
Um,
Um, I can never find something when I want to find it. Um,
it's okay.
I'm just looking it up for the listeners. Um, yeah, because I have quite a lot. Yeah, Listening to Smile is the name of the artist, and
Wow. Okay.
they actually have, I guess you could call it an album that is called For Pain Relief. Um,
Amazing.
one of the tracks is called Floating on the Wind. Um, so there's lots of things out there that people can use to help with pain. But I mean, I had a
Yeah.
subscription with them for about a year, so I've got quite a lot of their music. And what I tend to do about 9 p.m. I have so my office where I am now backs onto my bedroom, so I've got my laptop. I I play the music, but then I go and lay in my bedroom, obviously in the dark, just until I feel like, okay, now it's time to sleep. And it just puts you in such a great
Uh-huh.
mood to
It's you.
to sleep, you know. It normally doesn't
Yep.
take me very long to
Well,
get to the
it's
point where I want to sleep. It's only about 20, 30 minutes. Um, and and especially this time of year as well, because it's dark quite a lot for quite a long time here. It's probably dark
Oh,
like 16 hours a day.
yeah.
Um, I'm tending to sleep for like 9, 10 hours a night and just feel absolutely amazing.
Well, yeah, of course. I think those are tools that we forget about how our bodies respond to those things. So when you're having trouble sleeping or extra pain or feel just agitated from maybe something that happened in the day, I mean, we use music all the time. People just put on their favorite song and they feel happier.
Mm,
Now, how we can actually influence our biology and our pain response or our neurological experience through sound, and the drumming is one, string instruments are another. There's even this controversy. I don't know if you've heard about the 432 versus 440 hertz
mhm.
controversy in music,
Yeah, I've
which
studied
is
music. I've
to
studied
say,
music production, so I know all about that sort of stuff.
oh, there you go.
Yeah.
So there is, I remember I included a study of this in my book because it's pretty powerful to say, even though the human ear may not catch the frequency difference between 432 and 440, but when music is tuned to 432, which is seems to be more biologically sensitive or active and supportive, then our bodies experience less of that fight or flight response or sympathetic nervous system response. And the study they did was people who going to the dentist, which is for most people a very like activating response if you're getting
Mm,
dental work done or the drilling and that happens. So they had people listen to 432 music or 440 hertz, and then they measure their saliva hormones before, during, and after, and then have them fill a survey of the experience of pain. And they collected, thousands of people in this study, and they found out that people who listened to the 432 hertz music, they reported themselves, they felt less pain, and their saliva hormones showed that they experienced less pain. Their cortisol levels were less, all the pain signaling hormones, all the cytokines that they were measuring were less. So there is something to that. Now, do we have some biological reasoning? Well, we can kind of figure with sound and resonance and what's more in resonance with our cells and
mm,
information. But I think it's important that we can pay attention and use that in our favor. So, I mean, even like you mentioned, if you start to listen to more music that is tuned to 432, and there is stuff out there, you might find that it works better. Some people tell me, oh, I listen to these like meditation before bed or whatever, it's not working. Okay, well, l- I don't know why, but maybe we try something different. And there are different frequencies that, that's a whole study in music and a whole study even in medicine about what frequencies do what for people. And we're starting to learn that this is a powerful, invisible but effective way of treating many types of problems and diseases.
mm. Yeah, and it's interesting that the
Yeah.
music industry went down the route of 440, and I don't think that was by accident. Um, but that's, I mean, even
That's a
even
question. Yeah. Yeah.
even all the the software now that's used for music production, you don't get any other option. Doesn't give you another option,
No.
right? So
Right.
yeah, that's a whole
Yeah.
nother rabbit hole. That one.
No, it is a rabbit hole. And then the question, who decided that and why? And that's, there is this, write it in my book as a kind of a controversy. And it's good to ask questions, but then let's just recognize, oh, we have this information. How do I use it in my favor instead of it being used against me? Maybe 440 isn't ideal for humans or just for physiology. Maybe you can listen to music and it's fine. But if you really want to promote a healing response, we should be thinking about tuning music to 432. I think
Mm,
that is enough evidence to say it's not harmful and it's probably going to help you. So let's try to include that into our regimen.
mm. Yeah, and that's not to say you shouldn't listen to, you know, everyday music, that pop music, or whatever you like,
Yeah.
house music, or whatever. Because if it's music that brings you joy, that's going to be healing for you anyway, regardless.
Mhm.
But yeah, there might be
Definitely.
might be
Definitely.
better frequencies that could be used.
Better, yeah. And that's another thing to say is just pay attention what you listen to and how you feel, because sometimes people listen to music as a distraction, but it's actually amplifying our negative responses. And so it's not by accident why things sell or why we get inundated by these things. I think everything is orchestrated in a way, not against us or whatever, but we have to pay attention to all of what we're consuming, and music is one of those. And if we want to be more positive or feel better, then being conscious about what you listen to is another way to shift your nervous system and shift your biology. So, yeah, if you like the music and you feel good afterwards, I don't know what you listen to, some Beatles or Bob Marley or something like
Mm,
that. I don't know what it's tuned to, but it always makes me feel good. That's
yeah,
perfect. But,
yeah,
there
I
are
agree.
questions about what else is out there. Definitely. Yeah, we should be paying attention to that.
Yeah, yeah, it's interesting. Yeah, I mean, yeah, if I listen to the Beatles or Bob Marley, yeah, makes me feel good as well. Um, yeah,
Yeah.
it's interesting, very, very interesting. Um,
Right. Yeah.
so we've discussed light, we've discussed sound. What about movement?
Well, I think movement, like obviously for most of therapists and things we're doing, especially when dealing with pain, is a priority of like our bodies are built for movement. We are, humans on this planet designed to move. And if we start to stop our natural movements, and it may even be just how we breathe, and breath is a whole nother category, but breathing is a movement in our body. And so what we can do is start to repattern our nervous system how to move in a healthy way, and also to let go of old patterns that may not be serving us, of how we hold our posture, because posture has a direct influence on our nervous system. And
Mm.
there are, again, studies, and if people want to know like what studies there, well, there are studies show how you hold your posture affects your emotions, and obviously vice versa. Our emotions affect our posture. You can tell when someone's not in a good mood, or having a bad day, or sad about something, or lost something or someone significant. And we
Well,
can
you could.
influence
I would just
our
add to.
biology by
I would just
changing.
add to that.
Yeah.
Um, try smiling and feeling sad,
Yeah.
right?
Well, that's
Or
an influence. You can
try slumping down and feeling confident and happy. Try standing upright
exactly. Yeah.
and not feeling confident, right?
Yes.
Our
Yes.
posture and
Yeah.
our emotions are completely tied into one another.
It's so connected. And to think like, oh, well, I feel this way. If I just change my posture, it's not going to fix anything. Well, it doesn't happen in 1 second, but the more you pattern and practice that, your brain has the signal that you are that emotion. Smiling, oh, well, I guess I have to leave and release oxytocin because this person is smiling about something. I don't know what they're smiling about, but and even watching somebody smile increases our own oxytocin. So I relate this kind of funny, but you go into any spa, they have these sitting, meditating, smiling Buddhas. Why? Because they're trying to impress on you the signal of relaxation, of peace, of confidence. There you go. Yeah, I'm the same way. So this is what's really important to recognize. These are signals our body is receiving, and we're making, second by second judgment calls of what our body needs in those moments. And to shift something, we can be intentional about it. And that's just movement, posture, smiling, what we put around us as feedback. Just like there are studies that people in rehab, if they watch people doing exercises, their body will heal faster than them not even watching. So the first stage is just observe someone doing exercises. Your body's going to start making signals like you are doing it, and then it'll be easier for you to do those exercises. And in spinal cord injury and rehabs and nerve injuries, they say that actually promotes healing faster. So I think movement is good. And the other thing from what I've experienced is that we get stuck in a posture or a pattern of movement that we think is our limit, but it's not really our limit. And so when you work with a really good practitioner or a therapist, what they're going to do is repattern your brain or help you to realize like, oh, my neck can only move like this. And if I move it like this, it hurts. And you say, well, that's kind of strange. Let me help you to discover that you actually have a different and a different range of motion and how to do that. And from an osteopathic hands-on approach, I do that all the time, and people don't realize, like, okay, let me give the signals to your system that it's okay to do this, and then you start to do it on your own. And I think we oftentimes, from an injury or from a trauma, we get stuck in this loop, and we need to figure out a way out of that loop.
Yeah. Yeah. I mean, movement is something that I've probably been using for the longest period of time to help people in pain. And, just simply from a posture, from a motor control perspective, when someone has, let's call it faulty posture or less than optimal motor control of their joints, the likelihood is they're going to
Yeah.
be putting excessive stress through certain tissues in the body, which is going to mean they're going to start to break down. That's just a very kind of simple way of looking at movement. But something that I think is really important for
Yes.
joint pain is the release of synovium from in synovial joints, right? That only happens
Mhm.
with movement. But
Yeah.
then you've got the chicken and egg. Someone says, yeah, but if I move, it hurts.
Right.
So, I always
Right.
say, how is there a way in which you can move that doesn't hurt? And almost everybody
Right.
I find, if they're in water, can move without pain. And even
Hmm.
even being in
Yeah,
water
that's
is
amazing.
therapeutic.
Water is a great. Yeah. Yeah.
Especially if it's somewhere like
Hmm. Yeah, and so
yeah, I was going to say, I mean, imagine in Costa Rica, the water is probably quite clean, certainly compared to California.
yeah.
And you've got all the salt in
Hmm.
there. You're getting rid of the free
Right.
radicals whilst you're in there. Um,
Oh, yeah.
it's a
Hmm.
great way to move. And we're not talking about doing
Yeah, it
butterfly
is.
or or anything like that. Just
Yeah.
just get in the water and move. However, whatever feels good. It can be walking along the bottom or
Mhm.
just doggy paddle or
Right.
whatever, floating on your back, whatever. It's still going to enable you to get some
Exactly.
movement in there without
Yeah,
creating
that's a
pain.
great solution.
You deserve to feel in control of your health and not overwhelmed by it. Most people are given exercises, medications, or generic advice without ever being told why their pain exists. My approach is different. I help you understand your own body, what it's reacting to, and how to create the conditions for healing. If you're ready for that level of clarity and support, you can book a discovery call at bodycheck.co.uk/consultation. Now, back to the show.
Yeah, water is amazing, and we are obviously you can use that in your favor, and getting people set up with the therapeutic use of water. As you mentioned, the salt is great. We have Epsom salt. I recommend people use Epsom salt to relax the muscles, increase circulation. If you can't get into a salty body of water like an ocean, and then use some Epsom salt in a bathtub, definitely you'll feel better. And then do the gentle movement in the water. 100%. That's great. And same for finding places in the world. Actually, what we used to do as a people would navigate to where they have hot springs and use mineral water or water from the earth, and that's incredibly healing. And there are places all over the world where you might just think they're the hippies or whatever gathering at these hot springs, but they are a lot of evidence of why and how they actually help the body in healing and pain response. So that's another option for people, is to look up, where there are these, earth natural gifts of the healing waters. And there is a lot of reasons we could go, and biologically, from the elements in there, minerals and salts, to there's another thing called deuterium depleted water, which it has to do with hydrogen.
Mm,
And we find that people's inflammation response goes down tremendously when they are in this type of water. And there are these home machines for this. There's other ways of doing it, but a simple one is just look for where people used to go, native and indigenous people, for their own healing using water. And that's an incredible resource. Of course, if you have a pool, great. If you have salt water, great. And look at these other resources. I love Epsom salt. Like I said, even just to, if you don't have a bath, I tell people, create like a big basin, fill it up with warm water, and put your feet in it. Put your feet in the Epsom salt water, and it starts to increase the lymphatics circulation and drainage. And help relax the muscles through the magnesium and other elements that come out of there. So it's a
Mm.
great reminder of yeah.
Yeah, it's interesting you mentioned that because before we started recording, you was telling me that you've been to Bath in England,
Right. Yes.
right? Because
Yeah.
that I mean,
It's
probably not so medicinal now, but years ago, that's exactly what it was, right? I mean, I think I haven't seen it for a long time, but is it
exactly.
still quite green, the water in Bath? The actual
As far
bars?
as I remember, yeah, they weren't necessarily. I think they started to clean some up, but personally, I don't know if they're which ones are open to the public or not. But in that way, you can just see people of our not so distant past spent a lot of resources, time, and energy to build this up around these type of
Mm,
areas in the world. And Bath is exactly what it says it is. It's a bathing place from
mm,
natural springs, and we
yeah,
have that all over the world. Ancient cultures from the Romans to all the Native Americans. We have here places in the world where people would go to heal, and it's maybe there's something to that.
mm.
100%.
Yeah, because Bath was built by the Romans
Hmm.
in England.
Yep. They had some good ideas, and I wrote in my book when I was studying about the history of some of these modalities, and using sunlight was another one. The Romans really, which is modern day Italians, why do they like to get out in the sun all day? Because they know that it really helps their health and longevity. And so the Romans would prescribe for the Roman army to be on the beach naked or to do exercise naked in the sun because they found that it increased their strength. And for men, when we get out into more sunlight and do exercise, it improves testosterone and improves our androgens, which help the building blocks of our cells and protein and our strength response. So it's not, I mean, I think we look at these things and think they didn't know what they were doing, but they, our not so distant, ancient relatives actually did things because it worked for them. And it's not because they
Mm,
just made it up because they saw actual responses. Maybe they didn't have the tools to measure like we have, but they could see that, oh, this person seems healthier. They don't get sick as much. They have a good physique. And if you do these things, this is how you maintain health.
mm,
And so I try to bring those reminders back to people and try to do it in a modern way. You can't run around in the beach naked. You might get arrested for that, but you can get more sunlight and get out to the
mm,
ocean. And I think that is entirely helpful way to think about our health and to think about it that we're using what nature has given us as free resources. And then if that's complicated, then we start to create a better practical approach of how to do that every day, like you walking by the water and getting out and moving. Is so important.
mm. Yeah, it's interesting. You mentioned red light, you mentioned infrared, you mentioned Epsom salts. So it's actually become a
Mhm.
weekend ritual for me. So certainly infrared sauna and Epsom salt baths, either Friday night, Saturday night, or Saturday morning, Sunday morning. Um,
Nice.
I've got a little issue going on in my shoulder at the moment, so I'm going to put some red light on that this evening, then do the infrared sauna, and then do the Epsom salt bath, and then do a cold shower. So that's kind of my I mean, I do cold showers every day, but
Nice.
the other stuff is
Right.
just weekends. Um, so
Amazing. Yeah.
final main question for you. So someone watching or listening to today, if they feel stuck in chronic pain, what simple daily practices from your energy medicine or sorry, everyday medicine approach would you suggest to them to help begin shifting their experience, even from today?
Yeah, thank you. I think, this is, why I wrote this book, Everyday Medicine, is to give people some practical tools, things you can include in your everyday life as steps towards, hey, is this helping me as another resource rather than medications or having to pay someone as a practitioner to, let's say, oh, well, I feel really great when I get body work or when I get an adjustment or get hands on therapy. But that's not sustainable because then I fall right back into pain. So what else am I missing? And some simple solutions, as we talked about during this podcast, and I'll try to lay it out in a simple way, is I think it's really important to get our circadian rhythm optimized. And that means that you wake up when there's sunlight, you try to get sunlight in the morning and try to get outside in the early part of the day and at least without a screen, without any distractions, that you're either walking, moving, or just sitting outside in your backyard or front porch and breathing and getting fresh air and just letting your body attune to where it's at in the day and where it's at on the planet. And that starts providing our body with the right signals to do what it needs to today. And as you mentioned, you're in the UK, and this time of year, the light is different. It's not a bad thing, but it means that we need to do something different in the winter than what we need to do in the summer. And that might
Mm,
mean we sleep more, and that's
mm,
okay. So, tuning your circadian rhythm is really important. Paying attention to the light we receive is very important. So that's step one. Step two is then trying to figure out for someone's particular pain, what are the inputs that make things easier? Is it come from a movement or posture standpoint? Could it come from the sound? Like I said, you mentioned this too. Before bed, you listen to something to help work out your nervous system, help you sleep better. So using some binaural beats or using some sound that is nature based or calming is also very easy, accessible tool. Anyone can start doing that today. And the third thing that I really find is something you can include into all the activities we're doing is focusing on how we breathe. And how we breathe gives a signal to our nervous system of if we're ready to run from a lion or if we're in a safe and comfortable space. The simple way to think of it is how much do I breathe through my mouth versus breathe through my nose? When we start breathing through our nose more often, our brain gets the signal that we don't need to be in that fight or flight response. And it starts to attune our nervous system into the parasympathetic mode. Then, if you think, well, I can't, my nose is stuffy, I have problems with my nose or a septum issue, then just doing a little bit what you can and what's comfortable every day is important. And that does improve. And there's definitely studies that if you don't use it, you lose it, meaning that our nose, and when we don't use it as much, will start to block us from breathing from it. So just little by little makes a difference. And when we're doing our, let's say, sunlight therapy in the morning, if you just take long and slow deep breaths and have some timer or have something 5, 10 minutes of just breathing consciously, it starts to tune our nervous system into a mode where it's able to do more healing because chronic pain will alert our nervous system something's wrong all the time. And it's an amplified signal, and we get burnt out in that signal. And the more we can balance that signal with, I'm okay, I'm in a healing mode, I'm working on this issue, then our brain and all the neurochemicals, all the inflammatory chemicals, our immune system tone down to make things more tolerable and easy. So then you're able to, let's say, do that therapy today. You're able to do a little extra treatment or physical therapy or movement based on your nervous system has the capacity. So I like to just stage it that way and try to feel, oh, wow, it's actually not hard. And I get a measurable impact. Like I didn't know, like I couldn't move my shoulder this way because it was hurting so much, but because I toned my nervous system down, I got more present. My breath is right. I'm getting my circadian and sleep cycle working right. The pain is more tolerable. So I actually didn't realize I could do more than I thought. I think those are so simple and easy, but the best way is to experience it and not like second guess of like, how is this going to help or whatever. I just say, try it. Try it for 30 days. Try something for 30 days and then reflect. Is it really working? Is it not? What's the cost to you in this? And that's a big part of kind of what I do is try to get people to experience these issues or experience these principles, because the only way we're going to know if something's working is if we put the effort and energy into doing it.
mm.
So experience it, and then you'll have some feedback. Don't let your mind get in the way. Try not to let "Oh, well, I tried this before, it didn't work." Well, how long did you try it? Did you do it intentionally? Did you put the effort in? 5 minutes a day. Maybe it was 10 minutes a day that you need to do it. You stopped after 3 days because you didn't feel anything. We do need to put the effort in and create a good pattern. And that's another part of having a good practitioner or having a good therapist or someone to work with, because they help to motivate you to be in alignment with repatterning our habits that don't serve us. So that's a
Mhm.
big part of any type of therapeutic plan, is doing something different and having someone to support you if you don't feel confident in doing it yourself.
Yeah, absolutely. I mean, one of the things as well, about working with a practitioner, especially someone who's really experienced, they've already seen all the pitfalls before. And, what I try and do with people is to try and ask the client what they think might get in their way, right? And
Mhm.
then once they
Well,
come up with,
they know before you.
you know, weddings, parties, you know, lunchtime meetings at
Mhm.
work, whatever it might be. So great. Okay, excellent. There's all these potential obstacles. Let's come up with a plan now so that when you have a wedding, when you have a lunchtime meeting, you've already got a plan in place so that you don't have to give up.
Yeah.
You've got another option. And that makes things a
Mhm.
lot easier as well, just going down that route.
Yeah. Yeah, having the plan and then having it. I don't even say, like, if we keep it in our head, it's easy to forget. So write it down, put it on a board in front of you, put your schedule out there, put your reminders in your phones or on your calendar. And the more likely we're going to be successful if we do that. And I tell people, like, set your alarms. Okay, I know at lunchtime I'm supposed to get up and walk around and not sit all day. So you have to do that. And there are exceptions, which is normal. We're humans, we have different things going on. But the more you stick to that schedule and set yourself up for success ahead of time, the more likely you will be successful.
Yeah.
And I think that's important, to arrange our life that's in our favor rather than just going by the fly and hoping that it gets better.
Yeah. Yeah. I mean, it's all well and good having the best advice in the world, but if you're not able to carry out that advice, the advice
Exactly.
any isn't effective.
Yeah.
And
Right.
just over a year ago, I actually released an online course called Stickability, and it's for people that keep trying on going on a health plan, but for whatever reason, they might sabotage themselves. Um, I'll put a link in the show notes for that.
Nice.
So, you know, buy Michael's
That's,
book,
that sounds like a
buy
good
my
resource.
Stickability course, and you've got no excuses whatsoever. Awesome. This is
Well, that's what we like to think, and it's amazing.
Yeah, awesome, awesome. So, Michael, what's next for you?
Well, this kind of goes along with what we were talking about. What I like to do is get people to experience these practices, and oftentimes it's hard to do in our day-to-day life or our environment. So I have a health and wellness retreat in Costa Rica coming up uh, in May of 2026 this year.
Nice.
And it's about experiencing these multiple principles in real life, in real time, in an environment that supports health, so that we can imprint the experience in our body and have some tools to use that work for us. And that comes from circadian rhythm approach to better sleeping, better eating, and getting sunlight, getting outdoors, nature time, and then learning practices. I'll have like a practical every day, a discussion every day, and then time to experience things from sound baths to different types of movement and different types of breathing. And another big part of my retreat is just kind of working out, what's your intention, what's your goal for yourself, trying to figure out where your roadblocks are. And that comes in the sort of mental field or realm. And I have other treatments available for people, from hands-on work. I love doing cold therapy and cold plunges, and that's going to be available too, just for people to experience things maybe they never experienced before, in a safe way, in a way that is in a context, not like biohacking, but in a way that, hey, let's experience something. And you have a support team, myself and other practitioners, to say, like, what feels good for your body. And then you develop a plan, you experience it, and then take that back home. So I'm planning retreats and experiences really because that's what's helped me the most. I'm very kinesthetic physical person.
Mm.
I like learning things and then I like to apply it. So anything I tell someone to do, I've done myself, and I gotta experience that. And I'm sure people will understand when they do it why it's effective. So that's what I'm excited about.
Mm. Yeah, that sounds really good. That sounds really good. Sounds like the kind of thing I could do with at the moment. I tend to work too much, so the thought of something like that sounds great to me right now.
This is
Um,
Yeah,
sorry, go ahead.
well, you're invited, and anyone else you're expected to come out and enjoy a different environment and a different experience, because sometimes we do need to do that as a reset, and we'll feel it in our body to know what's good for us, and it's really important in our modern life. We do work too much. We're get stuck in these loops and cycles, and it's important to take a break and focus on our health.
Yeah, absolutely. And before we wrap up, where can people find you online? Where do you want to send people?
Yeah, I have my website's a good resource. It's everyday-medicine.com, and I have information, retreats on there, and then I put educational videos up. I have my an Instagram, it's Dr. Michael Blahut, and I just try to spread good educational resources. I do online consultations for people on there, and depending on what their needs are, I can help direct people to different resources and different people that I know around the world. So I'm happy if anyone wants to reach out to me for any questions or setting up any consultation or just interested in learning about the information that we talked about today.
Awesome. That's great. Michael, thank you so much. I've really enjoyed chatting with you today. The audience don't realize we've been chatting for about 6 hours trying to set the tech up at the beginning, but it's all good.
Feels like that, but we got it working, and it's been a great conversation. I appreciate your perspectives on it too, and I'm happy to connect with you in the future.
Yeah, absolutely. Absolutely. Love to get you back on at some point for sure. So that's it from Michael and me for this week, but be sure to tune in same time, same place next week on Beyond the Pain. Thanks for listening to Beyond the Pain. If this episode resonated, please follow the show, leave a review, or share it with someone you know who's been struggling. And remember, pain is not permanent. With the right insight and support, you can turn it into power. Until next time, stay open, stay strong, and keep moving beyond the pain.